Morning everyone. Okay, so today is Thando's dental day and vaccination day. The vet and the dentist are here, and the dentist assistant. That's their pickups. For you Zimbabweans, I was very lucky to find Vicky's a vet who's traveled Africa extensively and Zimbabwe in particular. Imagine, what are the odds of that? Of meeting a vet who's been to Zimbabwe, who knows people in Zimbabwe. What was that, Vicky? The tranquilizer?
That was sedative, yeah.
Okay.
And Banamine, which is an anti-inflammatory.
Okay.
So we get a before picture of his teeth here, and I kind of make sure that he's nice and straight and level across the incisors in case he needs a bite alignment. It appears that he's hanging on to a deciduous tooth or a baby tooth right here, slightly loose. There is evidence that there is a permanent one underneath that. So he's aging about 5. And he's also hanging on to a baby tooth right here too. So we will be extracting those today. So this is a full mouth speculum. And this is what we're going to put on his head with his front teeth on these bite plates. And that helps to hold his mouth open safely so I can examine all the teeth in his head and work on him without him biting down or chewing on instruments, and to do a very thorough job. So we open that up, and we're going to give him a nice good cleaning rinse to rinse any hay and food he might have in here. It's all coming out. Cleaning his teeth. This is kind of what they do to us, but we rinse and spit, or now they rinse and we suck it out. We don't have the spit sinks anymore. And we put them up and in behind there. And we can have an inspection of his teeth. Can you get all that in there, Dean?
Yeah.
Okay. So this horse appears to have what we call ETR. That stands for excessive transverse ridging. The chewing surface of his teeth are very strong washboard. Horses need to have some washboarding to bring the food back, to grab the food as they bring it back and able to chew down their feed good, but his is excessive. So I'm going to smooth that up a little bit and remove some very sharp edges here that can cut his cheek. And that's what we're going to be doing on Thando today. So Dean, I'll let you see the side, the comparison now of the one with the ETR.
Yep.
Filed down a little bit compared to the other side that I haven't touched yet.
Okay.
So you can see the extreme of that. Okay. We're going to give him a rinse, get all that dental dust out. Switch burrs. This is going to make the edges a lot smoother and bring it all together. And I'm going to make a place for the bit to sit comfortably in front of the first 4 molars. Okay, so we're done with the molar work. You can take a look. Okay. Teeth are all nice and no more sharp points. They still need some of the transverse ridging to be able to pull the food back to the mouth. Okay. So now what we're going to do, we're going to address these canine teeth. Hold the lip up, Kathy. Right here. These are their fighting teeth that only the males, or usually only the males, will have these erupt strong and long. And that's when you see pictures of stallions fighting each other. These teeth, these 4 teeth, 2 on the uppers, 2 on the lowers, can do the most damage. These don't even start to come out and erupt until a horse is about 4.5 years old as the horse matures.
Okay.
Okay, so I'm going to reduce and round those. They serve no purpose other than fighting. And they can really interfere with a bit. The bit sits right behind those 4 molars, or those 4 canines.
So how often will I have to have those done, or is this the only time?
Every year,
Growing.
they'll erupt his entire lifetime.
Okay.
Those roots on those teeth are 3.5 inches long.
Wow.
And they lie horizontal in the jaw and in the skull. So as they wear them down, and sometimes some horses don't wear them down, they get very long.
Right.
To the point where the tip is poking into the palate. And that becomes very painful for a horse to have his mouth shut.
Right.
They're like tusks.
Right.
So little tusk. So you can see on this side with the canine teeth how the tongue lays on it.
Yes.
Well, now that they're short and rounded up, it's not going to cause discomfort to the tongue. Or bring your camera on this side that I haven't done yet. And you can imagine as those get longer,
Oh, yeah.
see how it pinches the tongue.
Absolutely.
And can stab the tongue.
Right.
So that's why we address those and round them and smooth them and reduce them.
Oh, it's going to make it so much better for them.
Yes, it makes them much more comfortable in the bridle and for eating. So once I do all the back molars and the canines, I come and look at the incisors, and I like to see if they're nice and straight across, which his are almost perfect. And then I move the jaw from side to side, and I can feel when the molars come into contact, okay, because they don't use their incisors, their front teeth, the way nature wanted them to grab a hold tight of hard roughage food and pull. By feeding them grass and hay, they just use their lips and their tongue. The front teeth don't get the wear that the molars get in the back.
Okay.
So I have to address the molar or the incisors and reduce them to always make sure the molars are nice and tight.
Okay.
Okay. Because he's young, a lot of baby teeth, his is not that much of a issue at this age. And they never will be, because I know you're going to have me do them every year.
Yes, we are.
Clean that up a bit. Nice, slide nice. So now I'm going to check. He's holding on to 2 baby teeth that he was supposed to lose when he was 4.5. So I'm checking to see, and they're not very loose. So I am going to choose to leave them there.
Okay.
He's already lost the opposing one.
Right.
These should shed off by themselves in about 2 to 3 months.
Right. Do I need
If
to
I-
keep an eye out for
Yeah.
Okay.
You can
You
check
just-
them when we do spring.
Okay.
Yeah,
Okay.
there you go, just to make sure. But you will notice if one's kind of hanging out, because he'll be shaking his head and rubbing his face.
Yeah.
I don't want to force those off, because then you expose the permanent tooth to bacteria
Okay.
that it's not ready to handle.
Okay.
Okay, because that permanent tooth almost sits like in a little protective sac
Right.
till the baby tooth comes off. If the baby tooth is very loose and I can feel the permanent tooth underneath, I'll just go ahead and remove them. But it's a little early for him, so we're just going to let nature work.
Okay.
Okay.
So if I see it hanging loose, should I just pull it out? Or?
If he'll let you.
Okay.
If it's just dangling there.
Yeah.
If you have any questions, call Vicky.
Okay.
Okay?
Thanks, you guys.
Ta-da! The end!
Horse behind me looking at me.
Yeah, the bear's like, hey. Thank you for the explanations and stuff like that. I learned a lot today.
Oh, good.
Thank you so much.
You're very welcome.
Uthando. Ando.
What does that mean?
Thando, it means love in Zulu.
Oh,
Yeah.
oh my gosh. That is awesome. I got to even write that on this chart.
He's going to snort, so I'm going to get...
That's his strangle shot that he's just got. It's intranasal.
And some of it will drip out. About 6 inches into his nose, his cilia go the opposite way, and they'll take the drug up into his nose.
Okay. And what is strangles, Vicky?
Strangles is the shot is for something called Streptococcus equi, which is a bacteria that causes inflamed lymph nodes anywhere on the body.
Right.
And can kill the horse.
Okay, and it's a problem here in Arizona. Huh?
It is, yeah. The horses down at the river had it last year.
Right.
And I think
The wild horses, right?
Yeah, you ride at the river, right?
We plan to. I haven't with him yet, but yeah,
So
we'd
it's
like
better
to.
that he's vaccinated then.
Right. So that the wild horses at the river carry that strangles disease. So if we go for a ride out there and stuff like that, it's better to have them vaccinated for it.
And he got his rabies shot.
Oh, thanks, Vicky.
The problem with rabies, Gene, it's considered a core vaccine. If you don't give it and your horse shows neurological signs,
Yeah.
and we have to euthanize them, we have to send his head in to the
Oh.
laboratory.
Okay. No, that would be awful.
Yeah.
Yeah.
And if he should get rabies, he will die. So
Right.
Better to
Okay.
vaccinate.
So how long for the tranquilizer to wear off? 2 hours? Okay. All right, but it's going to be you and me.
Be a little careful for the next 2 hours because he's sedated.
Right.
You know, don't walk up behind him and touch him or anything.
No, I'll stay in the front of the store with him.
Yeah. Yeah, that'd be fine.
Yeah. And I just must make sure he mustn't eat, huh?
No food.
Okay.
Because he could choke.
Okay.
See, I got most of it out.
Thanks, Vicky. See, here in the first world, the vet actually raked the store. Can you believe this? To get all the stuff he could eat out. Vicky, can you show that tube that you just put up his nose? Thanks. Thank you.
You're welcome.
It went right up his nose.
There
So
we
that's
go.
a copy of the dental report, and then, sorry, you were saying?
Yes, this is a copy of his dental record here. So we write down his name. I had to write down the meaning. He's 4 years old, and I document everything I needed to correct. So this ridging here is called ETR, excessive transverse ridging. That's too much. Horses all need that, but this was excessive because he's not able to go chew tumbleweeds and trees with bark on it and keep that more worn down the way nature intended him to. So I had to reduce some of that so his jaw wouldn't lock. Okay, and I check off everything that I've done here, and I also documented that that's his baby tooth there, and there's a baby tooth there. That's his last 2 baby teeth to come off. So Dean's going to be watching for those so he could put something under his pillow for the tooth fairy.
Yes.
Okay, and there we go. I documented his weight today, and he weighs 1,183 pounds.
Thank you.
Yes.
Thanks, you guys.
Yeah.
Thank you so much.
You're welcome.
I really appreciate
Here's
it.
your copy.
Thank you.
Have a great
You were
day.
amazing. So everybody's leaving. I need to get the invoice from Vicky so I don't get into trouble with Linz. Bye, you guys. Thank you so much. Merry Christmas. Bye. Thanks, Vicky. Cheers, Vicky. Thanks so much. Merry Christmas. So that's all done.